Right. Students, today start topic discussion is we taken for Dentin bonding agent. So it is every 2 or 3 years once the questions are coming from the Dentin bonding agent, either in Neet exam or Inicet exam. And at the end of the session also, we are going to see whatever the question asked in Dentin bonding agent for the last 6 to 7 years as a quiz session. So in case if they ask you the question from the renting morning agent, so most of the time, if you know the concept, you can able to answer. And whatever the concept which is asked and maybe asked in a future exam, I mean expected topics and expected concepts will be discussed in this session. Okay, so start Parlama. So it is going to be a very short session, 20 to 25 minutes, very crispy. And whatever you know about, whatever you wanted to know about dental morning agent will be discussed in this session. Yes, let's start with some concepts. Right. So, for example, whenever you prepare a cavity during your third year or final year or CRRI for amalgam, so the cavity will be look like this, right? So you have adequate depth and you have dovetail, all this. So will be given some retentive feature for the amalgam to stay. So this is something pakka style to the cavity preparation. But in case of a composite, so the cavity will be like this. You need not to give the gingival seat. And the cavity is not like amalgam preparation. So just removal of the caries is more than enough in case of a composite preparation, right? So you won't give much concentration in your retentive feature for composite when you do the cavity preparation, right? So few more cavities, I just explaining. Okay, so like this. So the cavity for composite is something look like this, look like this. So here you can see. So there won't be no cavity like design for the material to hold, right? So these are some of the cavity designs for composite. But then how the composite stay in the cavity without much retentive feature? So now for this you have to know there are three retentive features or three types of bonding which is happening between the tooth and the restorative material. So the retentive features are number one, there is something called as mechanical, micromechanical, and number three, which is chemical. All the restorative materials retentive to the tooth or bonds to the tooth only by these three bond mechanism. What is called a mechanical? Mechanical is, just for example, amalgam. For amalgam cavity preparation, you need a minimum depth of cavity and you have dovetail, all this just to hold the amalgam. So this is called mechanical retention. What about chemical retention? For chemical retention, the best example is GIC. So the GIC, which has carboxyl group, which is binds to the calcium of the tooth surface. This type of bonding is called as ionic bonding, right? So this is actually an example for the chemical. The third type of example, which is called as micromechanical. Micromechanical is for composite. Micromechanical is for composite. So this micromechanical, you create a small porosities. This is porosities are called as microporosities. Through the microporosities, composite bond to the tooth structure. That is why you doesn't need specific cavity preparation designs like amalgam for composite cavity. Clear? So any doubt in this? Okay. So now for the micromechanical creation, what you need to do for the micromechanical porosities, to create the micromechanical porosities, you need to do something called as etching. You need to do something called as etching. Okay, so those days they used an etchant called as phosphoric acid 85 percentage. Phosphoric acid 85 percentage, which is the concept given by Bunocore. This is the original phosphoric acid, but now it was modified. Now the concentration which we are using is 30 to 50 percentage. It is asked in one of the exam. the concentration between 30 to 50 percentage mean should not be less than 30 or more than 50 percentage. Exactly, the concentration is 37 percentage orthophosphoric acid. These are all you know, right? 37 percentage orthophosphoric acid, 15 seconds. What happened if it is less than 30 or more than 50? So these are some of the expected question in your exam. Suppose if it is less than 30, it create a precipitate which is called dicalcium phosphate dihydrate. If it is more than 50, it causes monocalcium phosphate dihydrate. Both are interfere with the polymerization, right? So that is the reason you should not go for less than 30 or more than 50. So exactly between 30 to 50, and you can use 37 percentage for 15 seconds, right? When you do this acid etching, it creates porosities, right? These porosities, when you seen in the SEM, that is scanning electron microscopy, will be creating a three types of etching pattern. Again, one of the frequently asked question in your NEET exam in operative dentistry part. So what are the three types of etching pattern, which is type 1, type 2, and type 3. So what is this type 1? So the type 1, which the core of the enamel, where the core of the enamel is etched out. So because of the core of the enamel is etching, periphery is intact, it is giving some appearance called as honeycomb appearance. Clear? So coming to the second type of etching pattern. So here the core is intact, but the periphery got etched. So because the periphery got etched, it should look like cobblestone appearance. So this is honeycomb appearance, this is cobblestone appearance, and type 3 is indistinct. Indistinct means it is a combination of the two. So we cannot say this or this, it is a combination of type 1 and type 2 is type 3. So these are different types of etching pattern, right? Now, now this next question, what is the problem now? The problem is, so now you created a microporosity. So yes, well and good. So with the porosities are helps for the retention of composite, but there is a problem. Okay. So the problem is the composite, whatever you're using is high viscosity. Right. So how the high viscosity composite which enter into the smaller porosities, that is the problem. Okay. So for the problem to overcome, the scientists are came with a new idea called as enamel bonding agent. Okay, they came with a concept called as enamel bonding agent. Still, I am not entering into the topic. These are all small concepts which you have to know before go to the real dentin bonding agent. I'm still talking about enamel bonding agent. Okay, so what is this enamel bonding agent will do? This enamel bonding agent has diluent monomer. What is the meaning of diluent monomer? So this is called unfilled resin. So if it is an unfilled resin, the viscosity is reduced. So if the viscosity is reduced, it can able to flow into the small porosities. So once it flow into the smaller porosities, then if you give the composite also resin, this resin is attached to the unfilled resin already you are given to the tooth surface. This is how the enamel bonding agent works. Hope you understand, you follow me, right? So the porosities, the problem is there is a porosity which is smaller, high viscosity composite cannot enter into the microporosity. So what you are doing is you are decreasing the viscosity of the composite by giving something called as unfilled resin. Now this is called as enamel bonding agent. This enamel bonding agent can able to go through the smaller porosities. Over that you can give the real composite restoration. Clear, right? Okay, so now the enamel bonding agent is perfectly work when your cavity preparation is limited to enamel. Okay, but the second problem now is when the cavity is extended to the dentin. It's very important, students. Okay, there is a one more concept which you have to know here. So whenever you do the acid etching of the enamel, it increases the surface energy of the enamel. Students, just follow me. This is something which is very important. Whenever you do the acid etching, it increases the surface energy of the enamel. Whenever the surface energy of the enamel is increased, the bonding will be better. Okay, how much? This is again one more MCQ. Okay, 2000 times the surface energy is increased. So whenever the surface energy is increased, the wetting will be better. Clear? But the problem is when the cavity preparation extended to the dentin, it doesn't work. Enamel bonding agent doesn't work. Why the enamel bonding agent doesn't work? Because there is a difference between the enamel and dentin. Roughened enamel act as hydrophobic. Roughened enamel which act as hydrophobic. Enamel is phobic. Okay, resin also phobic. Resin also phobic. Resin doesn't like water. I'm talking about hydrophobic. Hydrophobic, this is also hydrophobic. So both will join together, no issues. But when it extends to the dentin, dentin is filled with the dentinal fluid. It is a fluid, right? So it is a hydrophilic. So dentin is hydrophilic. Composite is hydrophobic. So it doesn't bond. Okay, first problem. Second problem. So this hydrophilic dentin decrease the surface energy. Students, decrease the surface energy. This is also a old MCQ from the All India exam. Whenever you do the etching of enamel, it increases the surface energy. Whenever you do etching of the dentin, it decreases the surface energy. If it decreases the surface energy, no wettability, so composite is not able to bind to the dentin. So this is the problem. Now, what we can do? Yes, now the solution is you have enamel, you have composite. So composite is hydrophobic. Composite is hydrophobic. You have dentin. Dentin is hydrophilic. Okay, so not binding together. So for joining this together, in between, you are using something called as DBA, that is dentin bonding agent. This dentin bonding agent is a bifunctional. On one side, it is a hydrophilic group. Other side, it is hydrophobic group. So this hydrophilic group, which binds to the dentin, hydrophobic, which binds to the composite. So the problem is solved out. Okay. So now, even though the problem is solved out, okay, so there are many evolution which is coming in the dentin bonding agent. Many generations of dentin bonding agent which is coming out. Okay, so let's see about each generation of bonding agent, how it works. What is the difference between the each generation of bonding agents? So before this, what is this dentin bonding agent has? The dentin bonding agent which has something called as a group called MRX. Simply it is called MRX. So what is this M? What is this X? This is all expected question for your exam. So the dentin bonding agent like this M part is, which part is binds to the dentin? Which part is binds to the composite? So M is hydrophobic. So it binds to the, yes, it binds to the, so you can give it in the chat session your answer. So M is here hydrophobic. Whether it binds to the composite or binds to the dentin, students. Yes, very good. Aarti, Aparna, Swati, Rakshana, yes. Hydrophobic, it binds to the composite. X is hydrophilic. So it binds to the dentin. Clear? So dentin bonding agent simply called as MRX. And what is called R? R is the spacer which separates the two functional group. Very simple as such as. So this is the meaning of MRX. Let me go further. generations of bonding agent. Before that, let's go now. One more extra point. So what is called as smear layer and smear plug? So if we know this, the generation of bonding agent will be little easier. So what is called as smear layer? Smear layer is whenever you do the cavity preparation, so there is a layer of the surface debris of the tooth, burr particles, some microorganisms created over the dentin. This is called as smear layer. Some of the smear layer which enter into the dentinal tubules. So this area which is called as the smear plex. So this is called a smear layer and this is called as smear plex. So hope you are able to understand, right? What is called a smear layer, what is called a smear plug? Yes. Now, we go for the evolution of bonding agent, like how many generations are available. It's so easy, no confusion. Usually students get confused between all the generation. It's so easy if you know the concept. Right, totally how many generations are available? So totally you have 7 generations of dentin bonding agent. Let's see about each one by one with easy concept. First generation bonding agent. First generation and the second generation bonding agent. So the bonding mechanism of composite is not to the dentin, which is very important, students. Okay, composite. Suppose this is the smear layer, and if this is the composite is not bonded to the dentin. But where then composite is bond? The composite is bond to the layer which is present over the dentin, which is called a smear layer. Okay, why it is like that? Because in first 2 generation, the scientist, the dentist does not aware about the smear layer. Okay, simply they add a bonding agent over the tooth surface. So, but the bonding agent which binds to the smear layer only, okay, not binds to the dentin. So, the strength of the first 2 generation, first and second generation bonding agent is very, very less. Okay, I can say failure of the bonding agent also. Okay, I just repeat. First 2 generations bonding agent, the bonding agent is not to the tooth. Bonding agent is bond to the smear layer. Right. What is the strength of the first generation? The strength of the first generation is very negligible, which is between 2 to 3 megapascal only. Okay, which is very less when compared to the enamel bonding agent. Right. What is used in a first generation? So in a first generation, they used something called as glycerophosphoric acid dimethacrylate. Glycerophosphoric acid dimethacrylate. This is what used as a bonding agent in the first generation. I just repeat one more time. Glycerophosphoric acid dimethacrylate. So coming to the second generation. The second generation, which also binds to the smear layer, they used about phosphate esters of methacrylate. It is simply called as phosphate bonding agent. Phosphate esters of methacrylate. So what is this phosphate? Phosphate, you know, it is a very well. It has a negative group. Phosphate is negative group. This negative group of phosphate, which binds to the calcium of the smear layer. This is how the second generation bonding agent works. Whether the strength is okay? No, strength is very less, but comparative to the first generation, the strength is little bit higher. So what is the first generation bonding agent strength is? 2 to 3 megapascal. But the second generation, which will be around 5 to 6 megapascal. So hope till now the concept is clear for you, right? First and second generation. Coming to the third generation, which is very important. is third generation. What is third generation? The third generation, they came to know there is something called as smear layer. We have to remove the smear layer. Only if you remove the smear layer, the bond strength is increased. Right. So now what they did is they used about something called as etchant. They used something called as etchant. They used something called as conditioner. Okay. And they used something called as primer. And they used something called as adhesive. It is almost a four-step procedure. So what is this four-step procedure? Yes, first of all, so when you do the cavity preparation, so there is certain amount of enamel in some areas, dentin in some areas. So what is this scientist told? You have to do, if it is an enamel area, etch it. Enamel area, etch it. Okay. So enamel is more stronger. Okay. And conditioner. What is conditioner? Conditioner is mild acids. So if it is a dentin which has less inorganic part, so go for conditioner. If it is a dentin, you should use conditioner. If it is an enamel, you go for etchant. Right. So now this is what they did. Over that, okay, remember students. So I need your maximum attention here. There is something point which is a point which is very important. So once you etched, okay, once you etched, if it is a dentin, I told it is hydrophilic. Over that, if I do adhesive, what is this adhesive? Adhesive is nothing but again unfilled resin. Okay, earlier I told, right? Unfilled resin. Okay, so resin which does not have filler, so it is more diluted, so the viscosity is decreased, flow is increased. That is what adhesive. But this adhesive also resin. Appa, this is resin is what? Hydrophobic. Your dentin is hydrophilic. Doesn't bond. That is how where the primer comes to roll. So what is this primer has? Primer is bifunctional monomer. What is this bifunctional monomer? Yes, it has both hydrophilic and hydrophobic component. So the hydrophilic which binds to the dentin and hydrophobic which binds to the adhesive. Very simple, right? So what is called primer? Primer is bifunctional monomer. So what is this bifunctional monomer? Acetone dissolved in some resin which acts as, what is that resin is? The resin mostly we use is HEMA, hydroxyethyl methacrylate. Hydroxyethyl methacrylate is a hydrophilic resin. Students, this is old all India question. Hydrophilic resin, it is not hydrophobic. But the resin, what you are seeing here in adhesive, the resin, whatever you're seeing in the composite is hydrophobic resin. So what is that resin is called as? That resin is called as bis-GMA. Usually the bis-GMA has high viscosity. To reduce the viscosity, usually will be adding something called as TEC-DMA. This is again old all India question. TEC-DMA is a diluent to reduce the viscosity of the bis-GMA. So students clear, right? So what is the four-step procedure? We are doing the etching of enamel and you are conditioning the dentin. Once you did, you will have to apply the adhesive, but adhesive is phobic. So what you are doing is you apply the primer. Primer is have both hydrophilic and hydrophobic component. But here, so your composite is, your adhesive is directly bonds to the tooth, mean dentin, not to the smear layer. So because it is directly bonds to the tooth, so the strength is increased. So the strength is almost close to the 8 megapascal. Right. Strength is close to the 8 megapascal. Right. Now, coming to the fourth generation bonding agent. Okay, function of primer, you know. What is the fourth generation? Fourth generation is simplified version of third generation. So what is the concept of fourth generation? So they doesn't wanted to use etchant and conditioner in different area. They just wanted to use one single etchant alone. Okay, one single etchant alone. Conditioner is they're not using. So one etchant which is used for, if it is an enamel also etchant, if it is dentin also etchant. Clear? So conditioner is removed in a fourth generation. So this is number one. Number two, second step. What is the second step? Application of primer. What is the third step? Okay, which is adhesive. Okay, so only difference between the third generation, conditioner is removed, etchant, primer, adhesive. So this is for fourth generation. Coming to the fifth generation is again a simplified version of fourth generation. The three-step process is converted into two-step process. Now, etchant is done, etching is done. Okay. Now the primer and adhesive which join together in a single bottle. Okay. So the three-step process converted into two-step process. Etchant, after etching is done completed, you do with a primer and adhesive in a single battle. It's a single step process. So overall, it is a two-step process. Clear? So with the problem of so the fifth generation and fourth generation. Fourth generation, okay. So it is between the strength. This is also maybe asked in MCQ 13 to 30 megapascal. Fourth generation. Fifth generation, sixth generation, seventh generation. The next three generations, strength of these three generations, bonding strength is less. Remember, it is less. There's an evolution, but the bonding strength is less when compared to the fourth generation. So that is the reason most often we use fourth and fifth generation in the clinicals, not sixth and seventh generation. Clear? Now coming to the sixth generation, obviously it is actually a modified version of fifth generation. It is a more a simple procedure when compared to the fourth and fifth generation. Right? What they do with the sixth generation? The sixth generation, remember students, this is very important, very, very important. This is the concept of sixth generation is called as self-etching primer. It is a very important. Once asked in all in the exam, self-etching primer is what? Self-etching primer is nothing but, so you have three-step process, etchant, primer, adhesive. So here in a sixth generation, etchant and primer together in a single bottle. Okay, fifth generation la primer and adhesive. But here, etchant and primer in a single bottle. So the primer itself acts as an etchant. That is called a self-etching primer. Then you apply the layer of adhesive. This is called a self-etching. This is one of the model of sixth generation. There are two models available in a sixth generation. The second model of sixth generation, what you do is you just take an etchant, you take a primer, you take an adhesive, you mix all together and apply over the tooth surface, then give the composite restoration. So etchant, primer, adhesive together. But what you it is available separate, but you take and mix together and apply it over the tooth surface. This is what two models of sixth generation, but the sixth generation and the seventh generation bonding agent strength is comparatively very less. So that's why we are not evolution. Okay, we are not using much of sixth and seventh generation. Right? What is seventh generation? Yes, obviously it is a most simplified form of bonding agent, etchant, primer, and adhesive, which is available in a all-in-one bottle system. What is this all-in-one bottle? You need not to mix. The manufacturer itself mix all together, given in a single bottle. You just take it, open and use it. Okay, and do the composite restoration. This is called as seventh generation. This is all the evolution of generations. Okay. And so remember few more concepts here. What is called as hybrid layer? What is called as hybridoid zone? Okay, so students, again, these are small MCQs which are asking in exam. What is called hybrid layer? The hybrid layer is called as resin interdiffusion zone. Resin interdiffusion zone. What does that mean? Okay, so there is a dentin in collagen. You apply the resin which binds to the dentinal tubules and collagen. So this area, if you cut, it will be having the so composite mean the bonding agent and the dentinal tubules together. So this area, so which is called as hybrid layer. Clear? So who given this hybrid layer concept? The hybrid layer concept is given by a scientist called Nagabayasi. Nagabayasi et al. Okay, what is called a hybridoid zone? Yes, this is also very important, students. Hybridoid zone is after you done the etching process, when you dry the dentin, you should not apply the air. Okay, so you just take a paper, blot paper, and you just remove the over wetting of the dentinal tubules or over water of the dentinal tubules. So when you give a air pressure, what will happen? The collagen, if it is straight, right, the collagen will be straight like this. When you apply the air pressure, the collagen will be like this, intermingled. Okay, so it will be like this. Instead of it like this, it will be like this. So if it is like this, so your resin cannot penetrate in between the dentinal tubules, in between the collagen. So the bonding is not better. Now, this layer is called as, or this zone is called as hybridoid zone. So where resin cannot much penetrate into the dentinal tubules is called as hybridoid zone. Right. And what is this wet bonding concept? So, Manupriya, which part you wanted to ask? Once again, you just asking to repeat, right? Which part? Hybridoid zone, right? Manupriya, which part you wanted to repeat? Right. Okay, hybrid zone and hybridoid zone, right? Okay, nothing. It's very easy. What is called a hybrid layer? Hybrid layer is, okay, so there's the tooth, dentin. Dentin has collagen. Collagen will be straight like this. Okay. So when you apply the bonding agent will go in between the collagen. In between the collagen. So the bond will be better. In between it is going. So this layer where, okay, this is the collagen, it is straight. Okay, right. So bonding agent is going in between. Okay, if this area, if you cut and if you see, it will be having the bonding agent also, collagen also, right? Dentinal tubules also. This area is called as hybrid zone, otherwise called as resin interdiffusion zone. Clear, Bolupriya? Right. About what is called as hybridoid. Hybridoid. So whenever you do when you apply the bonding agent, before that you will be doing so air pressure. Okay, during your college days, you will be giving an air pressure, three-way syringe. You do the airway pressure. When you do the airway pressure, when you wanted to dry the dentin, so what will happen? So this collagen will be like this. This collagen will be like this. Okay, instead of it is straight, it will be like this. So the resin cannot able to penetrate. So if the resin is not able to penetrate, it does not give much strength. So this is what called as hybridoid zone. That is the reason what they say a concept of wet bonding came. Wet bonding, which is concept given by a scientist called Kanka et al. What is Kanka did? So he just don't wanted to dry the dentinal tubules with pressure, with air. So he just wanted to take a blot paper and just wipe out the excess water present on the dentinal surface. So this is called as wet bonding technique. So the dentin is still wet, but it is not over wet. So the bonding is better. So this concept is called as wet bonding. Okay. Yes. Now there is a concept which you should know, something called as total etch concept. Okay. This is also once asked in exam. What is called total etch concept? Total etch concept is the fourth generation. What we did in the fourth generation? So you just take an etchant. Okay, the etchant which is used for enamel and dentin both together, right? So when you do etchant of enamel and dentin together, then it is called as total etch concept. Very simple. Okay, right. So this is all together. So how many generations? 7 generations, right? Let's go for a fast recap of whatever we learned till now. There are totally 7 generations. So first generation is the strength is between 2 to 3 megapascal. Second generation is between 5 to 6 megapascal. And third generation is up to 8 megapascal. Fourth generation is 13 to 30 megapascal. And 15 is 25 megapascal. Sixth and seventh generation, the strength is comparatively less when compared to the third and fourth and fifth generation, right? So not sixth and seventh generation is comparatively less to the fourth and fifth generation. First two generation, they doesn't know about the smear layer much. So the bonding is between the bonding agent and the smear layer, not to the dentin. Okay, third generation, etchant, conditioner, primer, adhesive. What is fourth generation? Fourth generation, etchant is for both enamel and dentin. No conditioner. So etchant, primer, and adhesive. What about fifth generation? Fifth generation is 3-step process into 2-step process. Etchant in a single bottle, primer and adhesive in a separate bottle. What about sixth generation? Sixth generation is self-etching primer, etchant and primer together, adhesive separately. Sixth generation, there is one more thing. Etchant, primer, adhesive, you can mix it together and use it in a single. And seventh generation, the manufacturer itself, etchant, primer, adhesive, they mix together and they will be using. Okay, in a dental pulse, they will be given as a fluoride releasing bonding agent also in a seventh generation. Probably fluoride also added. Okay, so these are all overall together. You should know for a generations of bonding agent. Okay, Ajis, you asked about smear layer and smear plug, right? So what is smear layer and smear plug? Okay, let's go for this. Just I will explain with some picture. Okay, this is very easy. So what is called a smear layer is when you do cavity preparation. When you do cavity preparation, so there is a layer over the cavity, which is present. This is called smear layer. This smear layer which contain microorganism, tooth debris, and particles of burr, all which is present in this smear layer. Some of the smear layer which penetrate into the dentinal tubules also. Dentinal tubules, inside the dentinal tubules, not completely, part of the dentinal tubules are occupied. This is called as smear plug. Clear? Right. This is the overall concept which you should know for a dentin bonding agent, dear students. So hope you understand the overall concepts. So shall we go for a small quiz program now? Okay, for you to how much you understand the concepts, just answer for the 10 questions which is asked in the last 6 to 7 years in all in the exam. So you will be getting a complete pack. Okay, right. Now, okay. So take your phone, just go for joinmidquiz.com. Okay. So just go for joinmidquiz.com. Okay, I think only 20 or 25 students maximum can able to join in the quiz. So it is a first come, first serve basis. So just go for joinmyquiz.com and put the code. Okay. The code is 310961. So go to joinmyquiz.com and put the code number of 310961. So the question is all about the questions which is asked in several exam, several competitive exam. Okay, so if you answered this is more than enough to know about agent and bonding agent. Okay, shall we start? So anybody yet to join? Right. I think we can able to do up to 25. Okay, yeah, 26. Make it fast. Students, if anyone want to join, make it fast, make it fast, make it fast. Okay, let's start. Hmm? Let's start. If anyone want to join, you can join in between also. Okay, let's start with the first question. So each question carry over 20 seconds. Okay, right. So what is the question is, what is common in occlusal sealant, bonding agent, and composite? So all these three, what we are using is BIS-GMA. Even bonding agent is also BIS-GMA without filler, right? That is called unfilled resin is bonding agent. Okay, so even occlusal sealant also unfilled resin. Composite also filled resin. Okay, but polymethyl methacrylate, few of you is given. Polymethyl methacrylate is a denture-based resin. It is not used for composite and occlusal sealants. Students, remember this, right? Shall we go to the next one? So now you know the concept, right? Shall we go to the next? So this is the second question. Okay. So Aarti, which came as first, Pones, which came as a second. Acid etching is done for is very easy question, right? It was done for 15 seconds. Previously, we used 90, 60, all this. Now the concept is 15 seconds. Shall I go to the next question? Okay, so Purnar, which came first and biology came as second. Yes, it is also easy concept. Dentin bonding agent usually contain hydrophilic and hydrophobic. So easy question, right? Okay, these are the questions which are asked in exams. Easy questions. Next question. The question is accept. Srinidhi, Balaji, and Avinash. Okay, so it's so easy question. It they say about permit chemical bonding between, right? Obviously, it is a very wrong statement. So chemical bonding, which is happening with a GIC, not with a composite. Increase the surface area, yes. Acid etching increase the surface area, increase the surface energy. Only specifically if they ask you about dentin, then you should go for decrease the surface energy. Okay, overall tooth or overall enamel means increase the surface area. Yes, create surface irregularities. Yes, it is correct only. Condition the tooth surface for better wetting is, so this is also correct. Acid etching which do the conditioning also. So better wettability, it gives a better wettability. But obviously second option is so wrong. I don't know why so many of you made this question wrong. So easy question. Taj, Srinidhi, Kishore. Right. So answer for this is removes the smear layer, dentin conditioner. Okay. Increases the surface energy of dentin. I told it is wrong, wrong, wrong. So if you do the conditioner or etchant of the dentin, it decrease the surface energy. Students, don't make silly mistake. It decrease the surface energy. Dentin, enamel keta surface energy increased. Okay. So all this, which is wrong statement. So answer is smear layer. So helps in bonding with the composite? No. Actually, only bonding agent helps for the bonding, not conditioner. Okay, so conditioner removes the smear layer. Shall I go to the next question?